Hello, I'm Dr. Ong Mei Lin. I'm a cardiologist in Gleneagles Penang. This is a series of answers to questions that has been posted by all of you. And the question that I'm answering today is, do women have different symptoms from men when they have heart disease? To start, I'd like to let you know that death in women from heart disease beats all cancers. If you look at this graph, you will see the upper line is death from heart disease, and the lower line is death from all cancers. And you can see that death from heart disease beats death from cancers in women. There are many differences between men and women when it comes to heart disease. These include differences in risk factors, differences in signs and symptoms, differences in diagnosis, differences in treatment and prevention. However, for purposes of this discussion, I will only be talking about differences in signs and symptoms. For a start, 63% of women who die suddenly of heart disease do not have any prior symptoms. However, for those who do have symptoms, these are what they are. Women tend to present at an older age compared to men because women tend to have heart disease after menopause. Next, most women do not have the classical symptoms of heart disease, and up to 65% of women who do have coronary artery disease do not have what we call typical angina. What is typical angina? Typical angina is chest pain or tightness when you exercise or exert or are feeling excited. This pain is usually relieved when you rest. It is commonly associated with breathlessness, sweating. Many women who first show up in a hospital come because of angina. However, men tend to come with heart attacks as the first presentation. So again, this is different between men and women. Also, women may not have typical symptoms, and the symptoms they present with may not be chest pain. It may be jaw pain, neck pain, or shoulder pain. Some women only feel nausea or want to vomit. Sometimes it is an innocent symptom like tiredness or breathlessness or dizziness. So if you are in doubt, please consult your doctor. Finally, a woman is more likely to have a silent heart attack than men. So sometimes they don't even realize that they have a heart attack until after the event, and they have an ECG 2 or 3 years on, and we find that there is some scarring or changes to suggest that they may have angina or heart attacks in the past. So because of all this unusual presentation results frequently in a delay in diagnosis, both by the patient as well as by the health professional. So what do? If you think you're having a heart attack, call for help. Do not drive. Get an ambulance, get a friend, get a taxi, and go to the nearest hospital. Clinics may not have all the facilities you need during a heart attack, so go straight to a hospital. Thank you, and I wish that you all stay well.